The mastoid tip develops at 2 years of age. Now, what are the muscles that attach to mastoid tip? 2 muscles attached to the mastoid tip. Yes, the sternocleidomastoid, that is this one, and the posterior belly of digastric.
So please remember a very important point from ophthalmology. Just as oil drop sign in the nail is seen in psoriasis, oil drop cataract is seen in a very important condition known as galactosemia.
This injury is known as harakiri. This is suicidal. They hit, take it plunging, and viscerize out.
It's very difficult to resist this temptation. Immediately after shocking, you feel like looking at the monitors to check whether the shock worked or not. Now, irrespective of whether there was a sinus rhythm or not, it's important to continue 2 minutes of CPR.
Now, this metabolism which happens with the drug, when it passes through the liver for the very first time, this is called as first pass metabolism.
And this consumption of fava beans causing G6PD deficiency is called as favism.
Now, instead of the fracture of the upper 1/3 of ulna, which we noticed in Montese, you have a fracture of the lower 1/3 of radius.
The number 11 blade is pointed, and this number 11 blade is also known as the stab blade. And where will you use the stab blade? You will use it for incision and drainage.
If you see an expansile, multiseptated, soap bubble kind of a lesion involving only 2 bones in the body, right? Most common is mandible. Second most common or most common long bone is tibia. There's only one such tumor, and this is what is adamantinoma.
Once the shoulders are delivered, I let the baby hang by its own weight, right? And when the nape of the neck is visible, I will give a little bit of suprapubic pressure. When I'm giving a little bit of suprapubic pressure, that is promoting flexion, I am holding the legs of the baby and I am turning it towards mother's abdomen. This is called as the Bern-Marshall technique.
And very recently, just a few months back, we started with TD vaccine. But this TD comes again with a star mark that I do not want to burden you just for the sake of putting 7 changes. I have just included this. This is TD to be initiated in year 2020.
Sickle cell trait and sickle cell anemia. What is the difference? In sickle cell trait, there is some amount of adult hemoglobin which is there. In sickle cell anemia, most of this hemoglobin is replaced by sickle cell hemoglobin.
The fact-based questions are highest frequency and lowest frequency waves. We know the answer. Highest frequency is gamma, lowest frequency is delta.
Always start giving the laser shots in the inferior quadrant. Now, why so? Because there are vessels coming into the vitreous also. Although I aim my shot at the retina, the laser at the retina, in between there could be some vessels. So the laser hits a vessel, it will start bleeding.
So in case of influenza which has neuraminidase activity, we will see reversal of the agglutination of the RBCs.
So disruption of the alveolar attachment with thickening of the wall is what we generally see in small areas.
What is this anticipatory anxiety? Even before the attack comes, they kind of feel anxious and they kind of feel, oh my God, when is the next attack going to happen? Will it happen tonight? Will it happen when I'm traveling? Will it happen when I'm alone? Even before a panic attack happens.
So what do you mean by difficulty in it? Airway, either there is difficulty in mask ventilation or tracheal intubation.
Rachis is a condition that is due to failure of fusion of caudal neuropore.
The last one you have looks like a diamond. Remember, 6 to 7 years is the age at which the child is able to draw a diamond.